Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Boise State Public Radio and Duck Club Entertainment present the Charlie Hunter Trio.
Charlie Hunter Trio, everybody.
Wednesday, March 18th at the Shrine Social Club in Boise. Blending jazz, funk, blues, and rock, Hunter is a guitarist, producer, and bandleader who will present his unique finger-picking technique on custom hybrid guitars. Tickets are available now at theduckclub.com.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Over the past few years, debates about vaccines, public health authority, and medical freedom have become some of the most heated policy conversations in our state. In fact, lawmakers are currently considering Senate Bill 1346, which would place a moratorium on certain uses of gene therapy products, including mRNA vaccines for children and pregnant women. But are policymakers trying to solve the wrong issue entirely? Well, that's what Dr. David Pate, former CEO of St. Luke's Health System and co-author of the book Preparing for the Next Global Outbreak, is arguing in his most recent blog post. And he's joining us now to talk more. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, in your latest blog post, you argue that lawmakers are solving the wrong problem. So what do you believe the actual problem is that Idaho should be addressing right now? I mean, when it comes to vaccines and pandemic policy?
Well, the real issue behind all of this, which surfaced in 2020 with certain mask mandates, and then in early 2021 with certain vaccine mandates, was about that, about should people have the freedom to not mask, to not take vaccines in a situation where we're having a disease outbreak, or should the state, in fact, be able to require it, or other entities like schools or local municipalities and so forth. That was really the real issue. That is not a medical issue. That's it's a public health, societal, and political issue that the government should be tackling. Instead, everything that has been going on has been around attacking the masks, attacking the vaccines, instead of dealing with this specific issue.
So, Dr. Pate, you've worked not only as a physician, you've worked as an attorney and as a healthcare CEO. So I'm curious about those different perspectives shaping the way you look at legislation like Senate Bill 1346.
Yeah, so I have watched how the legislature's acting. I've looked at how some school boards acted and all, and they could really take a lesson from businesses and others. As a doctor, I was used to making lots of decisions every day based on a lot of data. As an attorney, I was used to looking at what are logical arguments and where does the logic fail. And then as a CEO of a large organization, generally I was faced with decisions for which there isn't a known answer, because if it was, it wouldn't get to my level. But how to make those difficult and decisions, particularly when risk is involved, when no one does know the right answer. And yet the school boards didn't seek advice from CEOs of large companies that could have helped them with a decision-making framework. And now what we see is that the legislature is really wasting time and resources that we would never do in a large business, going after things that frankly are ridiculous, and they're not going to solve the problem. In fact, they're going to make the problem worse.
Well, and a central theme in your blog post, Dr. Pate, is medical freedom. I mean, you argue that this bill could actually limit medical freedom rather than protect it. I mean, I am under the impression that medical freedom also means you have the freedom as a parent to choose not only if you want to get your child vaccinated or not, but whether you want to use an mRNA vaccine on them. So, can you explain what you mean by limiting medical freedom?
Well, I think you said it nicely. It's not freedom when you say, okay, this certain group is going to have freedoms not to do something. But then you're going to tell the other group that does want to do something, like those of us that do want to get the vaccines or have our children vaccinated or have a woman be able to get vaccinated during her pregnancy to protect her unborn child. Uh, when you take that away, that's not medical freedom. And so really what you can see, this is how when I was the CEO and I had to assess whether people were telling me the truth and whether people were whether I could trust them is I look for internal consistency. Here is a blatant example where the internal consistency is falling apart. What they want to have is okay. Freedom means that you don't have to take the vaccines the vaccines, which that may be the right decision. But instead, what they're doing is saying, we're just going to put a moratorium or a prohibition in so no one can get them. That's not medical freedom.
And in fact, you've said that what should happen is a comprehensive review of Idaho's pandemic response instead of legislation like like the Senate bill. So, what would a review look like? I mean, what kinds of lessons should makers be focusing on before we have the next public health crisis?
Yeah. So, and I have been asking for this for like 6 years. Let's look at what did we learn from the pandemic? What did we do well? Because there were some things we did really well. And what didn't go well? And so, how do we prepare? Because if we don't deal with this, then it's just going to be up to whoever's in office when the next major disease outbreak or pandemic or act of bioterrorism or whatever it is comes in place. And now they have to scramble and make decisions right off the cuff. Why don't we sit down while things are fine and let's go through a systematic process? And it's not just about vaccines and masks. It's about supply chain. How are we going to
Mhm.
ensure as a state that we're going to have what we need? How are we going to keep schools safe? And frankly, I think that the best thing would be is if the legislature could have, instead of focusing time on these ridiculous bills, let's have a retreat with the legislature. Let certain experts like me, there's plenty others in the state, come together and frame, first of all, give the legislature education because the next pandemic could be very different than this. I fear that they think they're all going to be like this. That is
Mhm.
unlikely. And so give them education and then pose questions to them that will raise considerations that I am pretty confident they haven't thought of so that we can begin to come up with a framework for how the state would react.
Well, and one of your key points, Dr. Pate, is that complex problems shouldn't be reduced to just simple black and white solutions. So, in your view, how has that kind of oversimplification impacted public health policy since the pandemic?
Well, this is the perfect example. COVID, the COVID pandemic was actually a complex problem. And the only people that don't see it as complex is because they don't understand everything behind it. There was a lot of complexities to it. But what the legislature is doing by not thinking forward and planning for the next pandemic and trying to come up with some guidelines and a plan, what they're doing is they're making decisions about something that occurred 6 years ago, and And to my knowledge, there are no mask mandates or vaccine mandates in our state right now, and yet they're passing emergency bills and this and that. Like the emergency is over, people, and it's time to think about the next. But by doing that, they're making decisions based on COVID that are going to bind everybody's hands so that when we face a completely different threat that they haven't even contemplated, we now have to react as a state with our arms tied behind our backs. That's the kind of poor decisions you make when you overgeneralize based on a specific problem.
Well, and in 2 days, we'll be 6 years out from when everything shut down nationwide when it comes to when COVID hit. I mean, that's a long time, right? I mean, it's more than half a decade. And I bring this up because you've also raised concerns about how all of this could impact Idaho's ability to attract and retain physicians. We know we have a physician shortage in the state of Idaho. So 6 years out from the lockdown, what are you now hearing from doctors about practicing medicine in the current political environment?
Well, the first thing is that we've had legislators who have undermined the practice of medicine. It's very striking to me because, as listeners know, I've been a lifetime Republican, and our view was keep government out of business and keep government out of family issues to the greatest extent possible. And yet, what we have seen is the legislature continuing to insert itself in between doctors and their patients. So that's the first thing. Second is that when they do things like this, for example, this very bill that you mentioned, and they're talking about gene therapy, well, that just shows they don't understand. mRNA technology is not gene therapy. That is something completely different. But when we see this kind of confusion in the legislature, and they're confused because they're not asking real experts. They're not asking physicians that are knowledgeable in these things. And when they see that the legislature ignores them, the legislature doesn't understand and is over inserting itself, and when they see that they're passing laws to put doctors in jail and so forth, then they're thinking, every other state is looking for doctors as well. Why should I come here? And then the converse problem is that, again, without understanding what the real problem is, the legislature now thinks, oh, okay, well, then maybe we just need to buy a medical school. And they don't understand that will be a very costly mistake if they're not going to change the rest of the environment. Because you're not going to solve the problem that how they're alienating physicians and even driving physicians away by buying a medical school.
So, Dr. Pate, in your opinion, if lawmakers truly wanted to strengthen Idaho's pandemic preparedness or even public health preparedness, what are maybe two or three concrete steps that you believe they should be taking right now?
Well, so first of all, would be to explore some potential scenarios to say, okay, are we really going to say there are no circumstances under which we would require masks or vaccines, and give them some scenarios? What if this happened? What if that happened? Now, if they conclude at the end of that, yeah, we still would not do that. Okay, that's a policy decision. Now we have to talk about, well, then, if you're not going to do those things, what are we going to do? One of the things that has baffled me through this whole process is, with all the emotion about, masks and vaccines. Okay, if you don't want to do that, could we talk about improving air quality in schools? Could we talk about ventilation, air filtration? Could we talk about some of those kind of things? Because if you're going to take away all of the other tools that we have to control a disease outbreak, then let's look at what are some other mitigating factors we could do. Air handling, air ventilation, those kind of things, infiltration, those would be obvious choices to look at. And because what they should be realizing, and we see this playing out across the country, is when you don't do the vaccines, you don't do masks and all, the diseases still happen. And what happens is you get to a point where there's so many teachers out sick, you can't have the school anyway. That can't be our objective. So you got to go back to what's our objective and then what are our options and under what circumstances.
So, Dr. Pate, there's a respiratory virus that a lot of people have never heard of, and it's showing up in pretty high levels in Boise's wastewater right now. Okay, so first, what exactly? I don't know if I can say this right. I know the first word is human, and then it's meta metaphonomovirus.
Yeah, close.
Almost. Okay.
So close.
All right.
So close.
So close, but yet so far. Um, so you say it right. Tell us what it is, and why are we hearing more about it right now?
Yeah, this is a common virus that is seasonal, and it's actually related to the RSV virus. It's called human metapneumovirus,
Okay.
and and it is mostly a problem for the young and old, like many respiratory viruses, and those that have underlying lung disease. I actually got it about 3 years ago, and I thought I was going to die. And I am in pretty good shape. I
Mm.
exercise every day, and but I got it, and the cough was unceasing. And for the first time in my life, I knew what patients meant when they were telling me that they were just too tired to breathe. You just get so tired from working so hard, and so it can certainly be a very nasty virus. For most people it's not. Almost everyone's infected it with it by the time they're age 5. The problem is we don't develop lasting immunity from it, and there's no vaccine for it. But in these winter months it usually surges. Right now it's quite high, and it will typically fade out before summer.
Okay, so Dr. Pate, how do folks who are feeling sick tell the difference then, right, between this latest virus, COVID? I mean, the flu's been really bad this year, or just even a bad cold.
Yeah, and you may not be able to, because many of these viruses do cause very similar symptoms. Some things that are somewhat useful, but you're likely going to have to get checked to determine exactly what you have. With regular cold viruses, typically you're not going to get a high fever. If you get a high fever, then that is more likely that you've gotten influenza or perhaps this human metapneumovirus, particularly if you're very young or very old. And then with influenza, a lot of times people can tell me like the minute they got sick. That at 12:30 it hit me because it comes on so quickly, which cold viruses and all don't typically do that, and human metapneumovirus doesn't do that. And the other thing that sometimes can be a telltale sign, although it doesn't happen with everybody, because influenza inflames the muscles, some people will tell you it hurts to move their eyes, and
Mm.
that I typically find very suggestive of influenza because it's the eye muscles that are inflamed, and so
Mhm.
moving their eyes from side to side they can tell you that hurts them. And then with human metapneumovirus, that one can certainly be predominated more by cough, which is less of a major symptom. It certainly occurs, but it's not usually predominating with these other illnesses.
So, in other news, the CDC is reminding international travelers, Dr. Pate, to check their polio vaccination status because there's been detection of polio virus in several regions around the world, I mean, including parts of Europe. So, Dr. Pate, why is the CDC issuing a travel advisory? I mean, what is this about, and what should folks need to know?
So, what I am very worried about is we don't really do polio virus surveillance in the United States. And the reason is that, we largely eliminated polio from the United States with the very effective vaccine. But like the recurring story of everything that we're talking about, as people start losing confidence in vaccines, which is another unwanted outcome of the nonsense when the legislature gets involved in these things instead of the real issues, they may not be getting the polio vaccine. And RFK Jr. has come out and really just said some very alarming things about polio vaccine that are totally untrue. But I'm very afraid that people are following his advice. And so we may have more susceptible people in the United States than we think. Usually, the only time we see a polio case in the United States is an international traveler coming here, and then it's somebody that didn't get vaccinated. But we still face that risk. But now there are countries that we don't typically see polio circulating in, like the UK and some of the other countries listed. That if you aren't vaccinated, you really need to give this thought, because the problem is if you do get polio, there is the potential for you to get the condition called poliomyelitis, which can be a paralyzing and permanent disease.
And Dr. Pate, very quickly, we've only got about 2 minutes left, but I want to talk next about this really large measles outbreak in Utah right now. Health officials say it's worse than they expected. So, what does this mean potentially for Idaho as we are a neighboring state?
Yeah, I'm concerned about this. First of all, I fully expect that we're going to see the measles move from Utah up here. We'll see. Usually, measles drops off over the summer, so we might not see it until fall, but we'll just have to see what happens. But what is concerning is they are seeing some very severe cases. That may just be chance. It may be that because we are not used to seeing measles infecting older kids and young adults like we are seeing now, that maybe we're seeing some more serious complications. What I'm very glad about is that they have called the CDC in to help them, and the CDC is responding. And so they're going to restudy the epidemiology of this and look and see if we can explain why it appears to be more severe. But I do warn people in Idaho, if your children are not vaccinated for measles, please get them vaccinated. It's coming. I'm certain of it. The vaccine's safe and very effective.
All right. Well, as always, Dr. Pate, so appreciate you and your perspective. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. If you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. Just by listening, you're helping to support public radio right here in Idaho. And I want to say a big thank you for that.